Good evening. I'm Dr. Smith, and I'm here this evening to talk to you about the Renin Angiotensin Aldosterone system, alcohol, and the effects they have in healthcare here at the Brisbane Hospital. I'm sure we've all been there on a night out, having one too many drinks, and you're putting off going to the bathroom for fear of breaking the seal. But what exactly causes this? To understand why this happens, it's important to note the human body uses a process called homeostasis to keep itself balanced and functioning. One of these homeostatic mechanisms is the Renin Angiotensin Aldosterone system. The renin-angiotensin-aldosterone system is an endocrine and paracrine system that uses negative feedback homeostasis to regulate body fluid balance and blood pressure. The various components of the system are the brain, the heart, the vasculature, kidneys, pancreas, adipose tissue, and gonads. The maintenance of body fluid and blood pressure through the renin-angiotensin-aldosterone system is a complex pathway that includes decreases in blood volume and pressure. This stimulus is detected by receptors and transported to control centers, which process the information received and dictate the appropriate response to the effectors. The initial effectors of the renin-angiotensin-aldosterone system are the kidneys and liver. In response to decreases in blood pressure and volume, the juxtaglomerular cells of the kidneys increase production of the enzyme renin. Renin is both stored and synthesized in the kidneys and is regulated by the sympathetic nervous system and hormonal stimulus. In conjunction with increased production of renin, the decrease in blood pressure and volume influences angiotensinogen production in the liver. Angiotensinogen is a glycoprotein that is synthesized and secreted in the liver and circulated in the blood. Renin acts on angiotensinogen, cleaving it to form angiotensin 1. As angiotensin 1 is circulated in capillaries, it is acted upon by angiotensin-converting enzyme, ACE, and converted to angiotensin 2. ACE is produced by the vascular endothelial cells of the lungs, peripheral blood vessels, and epithelial cells of the kidney tubules. Angiotensin 2 is an octopeptide vasopressor, which acts to cause vasoconstriction, antidiuresis, antinatriuresis, along with the release of aldosterone and the antidiuretic hormones. It also stimulates the hypothalamus to induce a thirst response. Aldosterone, another important hormone in the renin-angiotensin-aldosterone system, is stimulated by increases in angiotensin along with stretch receptors in the heart, responding to decreased blood pressure and increased potassium in extracellular fluid. Aldosterone is synthesized in the glomerular zone of the adrenal cortex and the adrenal gland. It acts to stimulate reabsorption of sodium and water in the kidneys along with the increased secretion of potassium and hydrogen in urine. Overall, angiotensin 2 combined with aldosterone leads to vasoconstriction and increased blood volume, which lead to increases in blood pressure until it returns to homeostatic conditions. Another homeostatic process that regulates blood pressure is the secretion of the antidiuretic hormone, ADH. Decreases in blood pressure stimulates osmoreceptors in the hypothalamus. These receptors activate neurosecretory cells of the hypothalamus, which synthesizes ADH to be secreted by the posterior pituitary gland. ADH is transported in the blood to tissues in the kidneys, pseudophorus glands, and the smooth muscle of blood vessel walls. This leads to decreased secretion of pseudophorus glands, arterial contraction, increasing water retention of the kidneys, and decreasing urine output. One of the ways it is believed that alcohol affects the renin-angiotensin-aldosterone system is by acting as a stressor on the vascular system, resulting in activation of the renin-angiotensin system and increased blood pressure. The most commonly agreed effect of alcohol is that it acts as a diuretic. The common consensus is that it acts to disrupt the secretion of the antidiuretic hormone, therefore having a diuretic effect. The consequences of disruptions in the renin-angiotensin-aldosterone system in healthcare are often severe and costly. Short-term disruptions to the renin-angiotensin-aldosterone system through stimulus such as alcohol can result in ill health and the requirement of medical treatments such as hospitalization for dehydration. Prolonged disruption to the renin-angiotensin-aldosterone system can have severe consequences including renal and heart failure. Now that you understand how the renin-angiotensin-aldosterone system works and the consequences of disruption, you can use this information to form treatments and early intervention pathways for patients.